They will today visit the Nqadu Great Place at Willowvale in the Eastern Cape to meet with acting King Dumehleli Mapasa and traditional leaders. They'll be discussing the issues of circumcision and funerals against the backdrop of the COVID-19 lockdown. Funerals and other cultural ceremonies are a huge challenge for law enforcement officials who've been struggling to ensure compliance of regulations, especially in rural areas. This has resulted in a number of arrests. The Eastern Cape has already cancelled circumcision, but illegal ones are still happening. Let's get more with our reporter, Atule Joka. Atule, very good afternoon to you. 310 confirmed COVID-19 cases in the Eastern Cape, 5 deaths. What's being done to try and curb the spread there?
Well, indeed, good day, Zinga. We are in Nqadu Great Place, as you rightly alluded. We are waiting for Minister Mkhize to travel from East London to come here and meet with traditional leaders to try and find some of those answers on what you just posed just now. We know that Nkosi Chief Dumehleli Mapasa of the right hand of the Xhosa Kingdom is the overseer in the kingdom. They did say to us that he's not a regent, he's not an acting king, he's an overseer. So he will come here and meet with those kings to try and deliberate over these issues as to why people still go to these funerals, and also on the issue of circumcision. It's not yet confirmed that it has been suspended. So after this meeting today, they will come up with those solutions as to what will happen, and also pertaining to the school calendar, which will be affected as well. Today is quite multifaceted as well, because when we got here, health officials were going door to door. Some went to the clinics as well. There were loud hailers to try and inform the villagers around here that there will be mass testings here around this village. But I am joined by the spokesperson in the province, Mr. Sizwe Kupelo, to elaborate more to us. But Sizwe, 310 deaths, 5 deaths, 310 infections, and also 15 recoveries. It seems like we are slow on recoveries in the Eastern Cape, and also what causes the spikes or on the infections as well.
Well, we understand the number of recoveries, because you will recall we're one of the last provinces to report on the first case. The issue as well, we are trying, pulling all stops to ensure that we get to as many people as possible in our province. Hence the campaign today, which is here in Nqadu. As I'm talking to you, our colleagues, our officials are in the village conducting door-to-door screening people, because we are dealing with this invisible enemy and we want to get to it and ensure that we protect everyone in our province.
Also, speaking of those mass screening and testing, do you just do them randomly, or you have targeted places? We
are here in this area because we started here. One of the first 3 cases was from the area of Amatole, hence the launch which we held in Willowvale, also here in Amatole. But we've got teams across the province who are going to villages, and also we're also being informed by the cases that we pick up, and also follow up on those cases, do the screenings, and also look at those who are eligible for quarantine and those who are eligible for isolation based on what we get on the ground. We are concerned. We've made this issue about the total defiance when it comes to funerals. People don't, they deviate from the stipulated number of 50, and that is causing a lot of problems in the Eastern Cape, because every weekend, every week after a funeral, we pick up a quite number of positive numbers, and we've got to follow up on those cases as we pick up to trace contacts and conduct screening and testing.
Okay. Speaking of those people who are infected, is also there are frontline service people who are dealing with those patients. We've received quite a number of complaints from some of your frontline services staff. They are saying some of them, they are not protected, and some of those CEOs do not want to give them protective equipment, particularly nurses. They are saying they are scared because in places such as KZN and also in PE, we've seen that nurses are also at the risk of contracting this virus. What do you say to that?
Well, that is totally out of order. We've got to deal with it. We've got PPEs that have been distributed to various health facilities, including districts across the province. We've got a team that has been given this responsibility to ensure sufficient availability of essentials that are required. But we've also picked up that there's confusion or a communication issue or some understanding when it comes to who wears what, when, how. We've got different categories of officials within a health facility. You've got your front line staff, which is your clinicians. You've got admins. You've got general working staff. So some of them would only require a mask. Some of them would require a mask as well as surgical gloves. But the front line, those would be dealing with positive cases. There's a protocol that is to be followed, which includes masks, disposable aprons, a mask to ensure that they are protected from contracting the virus. So those issues would be explained. We'll continue doing this. But I want to make this appeal. We are in this crisis together. We've got to pull all stops as one people to protect the nation against this virus. Yes, it's important to raise concerns, but let's play our role moving forward to ensure that we flatten the curve and we ensure that we protect those who are already infected and those affected by the virus. And also, people have got a responsibility to play their role. They should stay at home and not move around to aid the spread of this virus.
Speak. Oh, wow, because of time, we have to leave it at there. Well, there was the provincial spokesperson in the Eastern Cape, Mr. Sizwe Kupelo, saying, of course, he is urging for people to come together because we are fighting and this invisible enemy together. And also he's saying that the issue of PPEs in hospitals, we've got quite a number of complaints saying they will address that with the various CEOs who do not want to give those PPEs to their respective staff members. And Zinga.
Atule Joka, live from the Eastern Cape. Let's